Welcome back to the Undervalued Investor YouTube channel, where today we're taking a look at one under-the-radar stock called MyMD Pharmaceutical. We're going to break down the company, take a look at some of their pipeline. If that is a conversation you'd appreciate, as always, hit that like button, because MyMD is a clinical stage pharmaceutical company focused on the development of drug products that represent a transformation in the targeting of aging and age-related diseases, autoimmune diseases, and chronic pain, anxiety, and sleep disorders. Our team has partnered with academic founders and key opinion leaders to identify synthetic therapeutics, including the first drug being designed to significantly increase human lifespan. And we're going to take a look at their two primary drugs. But this company, MyMD Pharmaceutical, trades on the NASDAQ under MYMD for around 56 cents a share, or about a $25 million market cap. And reading into their two primary drugs being MyMD1 and Supera CBD. First and foremost, MyMD1 is a clinical stage synthetic plant alkaloid that has been shown to ameliorate immunometabolic dysregulation targeting immune cell metabolism. Its mechanism of action and efficacy in autoimmune diseases such as multiple sclerosis and thyroiditis and aging mouse models have been studied through MyMD's collaboration with several academic institutions. And to simplify this so you can understand it better, here's a video representing MyMD1.
What causes a person's body to attack itself? Why is a particular tissue selected as the target? Science has not fully answered these questions. Therefore, it's not surprising that most autoimmune diseases are treated by alleviating symptoms rather than addressing the underlying causes. MYMD1 is an immunometabolic regulator that, unlike current TNF-alpha drugs, regulates TNF-alpha instead of blocking it. MYMD1 is designed to stop the underlying causes of chronic inflammatory disease. Our immune system is a complex array of cells and secreted molecules that have evolved to prevent or limit infections and eliminate cells undergoing malignant transformation. Lymphocytes are immune cells with a special ability to seek out and recognize the antigens found on the surface of pathogens or pathogen-infected cells. Once identified, these invaders are targeted for eradication. If lymphocytes mistakenly recognize the body's own normal antigens, it can lead to one of a group of conditions referred to as autoimmune diseases. It is known that a group of lymphocytes called T cells play a key role in the pathogenesis of tissue-specific autoimmune diseases. When T cells infiltrate the tissue of an improperly targeted organ, they release the cytokine tumor necrosis factor, TNF-alpha, which induces deleterious effects in the region, including inflammation, autoimmunity, infection, and cancer. Interrupting the TNF-alpha pathway via the injection of anti-TNF antibodies, for example, has revolutionized the treatment of some autoimmune diseases like rheumatoid arthritis and inflammatory bowel disease by blunting the destructive inflammation that TNF can induce in tissues. However, these treatments are associated with significant adverse effects, such as the reactivation of latent M. tuberculosis or the lowering of neutrophil counts. Current therapies have proven unsuccessful at crossing the blood-brain barrier, limiting their effectiveness for inflammatory diseases of the brain and central nervous system. Therefore, the development of a small molecule that not only alleviates the symptoms of autoimmune diseases, but inhibits TNF-alpha further upstream by slowing or interrupting its synthesis altogether without any adverse effects and with the ability to cross the blood-brain barrier is highly desirable. MYMD1 has been shown in vitro to significantly decrease the release of TNF-alpha from Th1 specialized T cells, while in vivo in a mouse model, MYMD1 has decreased the incidence and severity of thyroiditis and infiltration of T cells into the thyroid gland. In preclinical research of multiple sclerosis, studies have demonstrated that MYMD1 can decrease the infiltration into the brain and activation of both Th1 and Th17 T cells, ameliorating the course of the disease. Overall, these studies suggest that MYMD1 could be used to regulate the overly active immune responses in patients with autoimmune diseases. In addition to published and ongoing studies at the Johns Hopkins School of Medicine, an FDA Phase 1 clinical trial is complete, and Phase 2 clinical trials are planned for multiple sclerosis, diabetes, Hashimoto's thyroiditis, cancer, frailty, Crohn's disease, and coronavirus, COVID-19.
Now, taking a look at Supera CBD, which is a synthetic preclinical cannabinoid derivative that has been demonstrated to effectively target CB2 receptors as a new molecular entity, which is patent pending. Supera CBD addresses the unmet need for a synthetic CBD with enhanced bioavailability and potency, so physicians may treat patients with an FDA-approved drug rather than a botanical that contains impurities. And also, to simplify this, here is a video representing Supera CBD.
In recent years, research has unlocked surprising benefits of compounds called cannabinoids found in the cannabis plant. Cannabidiol, or CBD, is one of 113 identified cannabinoids and accounts for up to 40% of the plant's extract. There are also two forms of CBD that are endogenous, or produced naturally by the body. These forms are used by our endocannabinoid system, a complex cell signaling network that regulates mood, sleep, metabolism, memory, immune and inflammatory responses, and many other important functions within the body. The endocannabinoid system uses two critical receptors, CB1 and CB2, which are found throughout the body and have a variety of functions. CB2 is of particular interest as it is prevalent in the immune system and has been shown to be important for regulating immune and inflammatory responses. Although plant-based CBD has a very weak affinity for binding to CB2 or CB1, it may still be able to affect the body's inflammatory response. Plant-based CBD also blocks the ability of the related cannabinoid, tetrahydrocannabinol, THC, to bind CB1, thus blocking the psychotropic side effects associated with THC. Because of plant-based CBD's mild association with these receptors, it has shown some limited promise in treating diseases associated with inflammation as well as anxiety and other neuropathic symptoms, and has been approved in the US and Europe to treat rare types of epilepsy due to its anti-seizure properties. Supera CBD, a scientifically engineered, synthetic form of CBD, has the potential to take all these benefits to the next level. Supera CBD has the ability to bind to the CB2 receptor with almost 4 times the strength as plant-based CBD. This powerful binding implies Supera CBD could possess even greater efficacy than plant-based CBD in treating diseases associated with the CB2 receptor, including inflammatory diseases, anxiety, psychosis, neuropathic pain, and even cancer. Supera CBD also differs from plant-based CBD in its ability to block monoamine oxidase type B, or MAOB. MAOB may have an important role in contributing to the damaging effects of Alzheimer's disease. MAOB synthesizes a neurotransmitter that inhibits certain signaling in the brain called gamma-aminobutyric acid, or GABA. Increased levels of GABA have been shown to cause memory impairment in animal models of Alzheimer's disease. Supera CBD's ability to block MAOB, thus blocking GABA production, raises the possibility that Supera CBD could demonstrate therapeutic effects in this catastrophic type of dementia. Supera CBD is also unique in its synthesis. Current methods of CBD extraction from the cannabis plant are imprecise and make it impossible to guarantee the purity of the extract. Supera CBD is synthesized in a controlled lab environment, allowing it to be created with absolute purity without risk of being contaminated by trace amounts of THC. Synthesizing CBD in the lab also permits Supera CBD to be made in high concentrations, allowing for much more powerful and potent doses in comparison with plant-based CBD. This potency, in conjunction with its improved CB2 binding strength and MAOB blocking ability, makes Supera CBD's capabilities far superior to those of plant-based CBD. Finally, lab-based synthesis of this unique derivative of CBD allows Supera CBD to be completely patentable. Plant-based CBD's inconsistent purity makes it difficult to patent and subsequently restricts its prescription to a narrow range of patients who could potentially benefit from CBD treatment. Patented Supera CBD would give providers the freedom to prescribe to a much wider pool of patients. Supera CBD provides and enhances all the benefits of plant-based CBD while simultaneously opening doors to new treatments and avoiding the side effects of THC. Supera CBD is potent, pure, patentable, and has the potential to significantly improve the treatment options for a number of diseases. Supera CBD will undergo rigorous FDA trials, providing physicians and patients with the data and confidence of a prescription pharmaceutical.
And in recent news, the FDA accepts MyMD Pharmaceuticals investigational new drug application IND for a phase 2 study of oral TNF-A inhibitor MyMDA-1 in rheumatoid arthritis. And just reading a quick quote, as the FDA acceptance of an IND in RA for our next generation oral TNF-A inhibitor MyMD-1 is our most significant milestone, as it adds substantial momentum to our clinical program with sufficient funding and targets one of the largest potential market opportunities. This company is heading into a very intriguing place in its history right now, and I feel like we're heading into some very pivotal milestone moments. But I'll pass the question off to you. We'd love to know what you think in that comment section below, and consider subscribing for future updates.